All right. Good morning, everyone. So Center for Community Resources in Clarion County is kind of a one-stop shop for mental health services. Uh, we oversee the Student Assistance Program as one of our programs. We have two staff liaisons, a couple of supervisors that are also trained staff liaisons. We cover only 8 school districts. We have 8 secondary schools and 5 elementary schools. We are extremely rural out here, and we only serve Clarion County. All of our staff liaisons are trained to give the BH Works mental health screenings, as well as do base service unit intakes should people need funding and financial assistance in order to receive those mental health services for them, for their parents, for their family members, and we're also crisis prevention support trained workers. Attached are just a couple of slides that kind of break down our school district. You can keep going, Tina. Okay. So we completed our staff trainings January 2018. Our staff liaisons, we kind of just informed the teams, hey, this is what we're doing next, and we haven't received any pushback regarding that. They were excited to have a tablet and be able to use that as a means of collecting information for our youth. We have a lot of youth that kind of downplay their feelings and their emotions, and having that ability to use a tablet to go through questions and answer them as accurately as possible has been really helpful for them. And then we summarize at the end together and we talk about what our next steps are. So the plan was to begin implementing in March of 2018 and then complete integration starting this school year. It's gone well so far. Next slide. So the CCR in Clarion branch has only been around for 4 years, so our SAP program overall is pretty new. When we first started out, we were getting just like 3, maybe 4 referrals a month. And so we've seen about like a 120% increase in our SAP referrals for this past year. Our quarter ones, only 8 referrals at that time period, and then we really jumped in quarter 2 to 47. We're just trying to get our name out there. I think the integration of BH Works has also been really helpful. Next slide. Okay. Quarter 3 and 4, similar numbers. We jumped from only 12 screenings the previous year to about 112 the following year, and we're on pace to smash those numbers this upcoming year. Next slide. So basically, BH Works has helped pinpoint and target issues and provides direction for our liaison. So that's been a real positive contribution for us. Students are able to answer freely, and most tend to answer honestly, even though they know it will be reviewed with the team. And they're able to see the results right away. They've been really, our students and our parents have been really interested in seeing those results and seeing kind of where they lie in the spectrum. Next slide. Okay. So we've seen an 83% increase in our SAP records, just previous stuff that I've already mentioned. And with BH Works, we've just become a lot more efficient. The only downfall is because we are extremely rural, sometimes even our hotspots on our phones don't work depending on the school and where we are in the school. So we're trying to maneuver that, but that is not, BH Works' fault. It's just kind of where we live. So we are adapting to those measures, but things are going really smoothly, and it allows for a lot less paperwork. We're able to transfer things from, the portal onto other systems that we use for tracking and reporting, because we have to track through different strands for our mental health services. So it's really helped improve how quickly we can meet with kids, get them through surveys, start scheduling with their parents, and a lot less paperwork. So we're really grateful, and so far so good. I think that's it.